On Thursday, the 15th of December 2022, the Meghalaya Health Minister James PK Sangma had inaugurated the DAE Civil Hospital Cancer wing and also launched the Meghalaya Mission Cancer Prevention and Early Detection. Also present was the Joint Secretary of the Research and Development Wing of the Department of Atomic Energy, Government of India, Sushma Taishete, other government officials, doctors, nurses and staff of the Civil Hospital Shillong, besides others. Addressing the gathering, James Sangma informed that the first cancer care unit has been initiated in collaboration with the Apollo Group of Hospitals and funded by the World Economic Forum. The FCC has been set up to detect the disease in its early stages so as to enable timely treatment and increase the lifespan in those undergoing such treatment.
I know it's not easy for them. They lead such a stressful life, and it is really, I think, once in a while, our words of gratitude are very important to show our appreciation for all the work and the sacrifice that they are giving and they are doing. So, really, a very big thank you from my side for all that work that has taken place for cancer care. Cancer is something we all know that you can just imagine someone going and with a small problem and being told by the doctor after proper diagnostics that he has been diagnosed with cancer. It's literally like a death sentence for so many people. It just, suddenly the world is very, very different. The kind of the morale that comes down and the kind of sadness that seeps in to any individual who has to unfortunately be told that he's been diagnosed with cancer. That is why I think that this disease, which has been so dreaded, this needs a special focus. This needs not just treatment and care, as Mr. Sampath was mentioning, but we need to move towards the preventive side of cancer. And there is a lot of science which is working towards how we can prevent cancer in the future. And let me assure everyone, the citizens of our state, that we as a government, we are wanting to take the bull by its horn here. And we want to really not just treat cancer, but also move towards how we can prevent this dreaded disease. And I'm happy that yesterday we signed an MOU with the Apollo Group, a program which has been sponsored by the World Economic Forum. And this, I feel, is going to go a very, very long way in tackling this disease. I'm happy that the FCC, the first cancer care project, is going to be associated and will work in tandem with our cancer wing. And a lot of activities will be taking place. Cancer is, as we all know, the treatment takes a very, very long time. It sometimes stretches over maybe 3 to 4 to 5 years, which is why a dedicated approach is badly required. And that's why the FCC has been brought about. We are looking at how we can screen. Early detection would lead to early diagnosis and early treatment, which would, I think, have a huge impact in the way that we treat our cancer patients, in increasing the rate of survival of cancer patients.